today, practical tips to support and empower caregivers. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. This is the third episode in our ongoing series on caregivers. Our guest today shares recommendations she's learned from working directly with caregivers that providers can start using right away. Allison Applebaum is a psychologist at Memorial Sloan Kettering Cancer Center in New York City.
Screening protocols for caregivers ideally eventually will be implemented across cancer centers, but I think that more informally, healthcare professionals, they are on the front lines per se, when they're meeting with patients and families versus the psychologist or social worker who are meeting with families down the line downstream. And so I think that it's quite important for all members of the healthcare team to be able to identify signs and symptoms of distress in caregivers and to know what resources are available in their unique cancer centers so that they can refer those caregivers or make the suggestion that they speak with a social worker, for example, so that they know that there's some support that can be given.
If you had to choose, what is the most important tip that you can offer us to really empower caregivers?
Gosh, if I were to rank order, the number one tip is to acknowledge caregivers' presence. Too often, caregivers feel completely invisible in the treatment room, whether that's a physical treatment room or a Zoom treatment room. Oftentimes, caregivers just feel like they're just in the background. And the reality is that caregivers are healthcare professionals' best friends. They're on the front lines. They see symptoms and side effects unfolding in real time. They have a more accurate understanding of patients' health-related behaviors than anyone else can, and they can best assist the medical team in implementing a care plan, and yet too often they are invisible. And so the number one step that any provider can take is actually acknowledging the caregiver, asking them how they are doing, a simple question, how are you today, and what can we do to help you, would be a great intervention. Anything that can be done to combat invisibility is really key.
What does the CARE Act do to formally create support for caregivers?
We have in this country what's called the CARE Act. This is the Caregiver Advise, Record, Enable Act. It is currently passed in 45 states and territories. It's not law, but it does encourage hospitals to do three things: to document the name and contact information of caregivers in the record of the patient. It requires the hospital to let that caregiver know when their loved one is going to be transferred or discharged. And very, very importantly, requires hospitals to provide caregivers with training and support so that they know how to take care of their loved one when their loved one is discharged. The time of discharge to home is one of the most overwhelming for caregivers. They have so many new responsibilities and skills that they have to implement. And without training and support, it oftentimes goes quite badly, actually. And so this is a very important moment for the healthcare team to be providing support for caregivers.
What do we need to keep in mind when working with caregivers?
So I think what's really important is that recognizing that caregivers are an extension of the medical team at home, and that we as a healthcare system are asking caregivers to carry out medical and nursing tasks that were once only carried out by professionals, that any steps that you can take to ensure that caregivers feel confident and competent in their ability to do whatever it is they're asked to do is really, really important. Any opportunity for caregivers to meet with nurses, to practice in front of nurses the skills that they're going to have to implement at home is really, really powerful.
Thank you to our guest today. You can head to the show notes for more resources and tips to better support caregivers. And if you haven't already, don't forget to go back and listen to the other two episodes in this caregiver series on the Cancer Buzz channel. There's plenty of practical tips in those shows, each in under 5 minutes. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.